novel coronavirus rapidly emerged as a public health emergency globally. It exerted tremendous pressure on the public health system. It demanded concerted coordination to implement various public health interventions effectively and timely. This video is part of intra-action review of COVID-19 response in the state of Gujarat based on WHO's 10 strategic pillars of COVID-19 Joint Response Plan. Present video highlights strategies employed under Pillar 1, Coordination, Planning and Monitoring.
That was mid-March, state government came out with a process wherein all decision-making authorities, beginning from Chief Minister, Health Minister, Home Minister, Chief Secretary, Finance Department, other line departments, their roles were carved out, and every evening one used to have a meeting, not used to, but we have been meeting even now. Without no Saturday has been missed, no Sunday has been missed, no public holiday has been missed, and all issues are thrashed, and meeting starts sharp at 6 o'clock and it lasts till we are through with our agenda. So the decision making process, without bypassing any system, without bypassing any procedure or process, but all of us are together, issue is flagged and a decision is taken, and regular due documentation as required in a government process is also done.
We in Gujarat developed a system. A state government appointed 4 senior IAS officers as nodal officers, dividing a state into 4 regions. And they had the mandate to see, on one hand, how to break the transmission of the virus. That includes surveillance, identification and enforcement of the containment zones, contact tracing, treatment. Thereafter, clinical management of the affected person. And that is how we could respond to the dynamic nature of the pandemic.
Daily, on a literally daily basis, we were learning, unlearning, relearning, and sometimes even U-turns had to be made in terms of what is the acceptable protocol, what are the theories, etc. So there were lots of changes which were being incorporated real time into it. And this also helped keep the political stakeholders and the feedback from the ground also completely plowed into the implementation framework.
This all started in March. On 22nd of March, the Janta curfew was there. So we had maintained bandobast at that time, and voluntarily people had remained indoors. But subsequently the lockdown was ordered, and we had to maintain peace and order in the city, and simultaneously we had to see that the people remain indoors. So for that purpose we had put Naka points in the city, and also at the district borders we had put checkposts. So our main role at that time was the enforcement of the lockdown.
Gujarat has swiftly taken coordinated actions to facilitate effective management of COVID-19 pandemic in the state, such as daily meeting under chairmanship of Honorable Chief Minister and Deputy Chief Minister with senior officials from various departments, deployment of senior officers from other departments, decentralization of financial powers and authority for quick actions, press conferences for dissemination of accurate information, encouraged contribution from the private sector in the COVID-19 response. This video is prepared by Indian Institute of Public Health Gandhinagar with support from the World Health Organization. We thank the Department of Health and Family Welfare, Government of Gujarat for their support and cooperation.